First, we'll welcome Dr. Stefani Connel of Novant Health Family and Internal Medicine, South Brunswick. Dr. Connel, welcome to the show today. It's a pleasure to have you back.
Thank you. It's wonderful to be back. I appreciate it.
It's been a while.
It has. It's been almost a year now.
I know, and I hope it's been a great year for you.
It has. I love the community. I love all the water sports that we're able to do, and I just loved being a part of the practice. So it's been a really good year.
Well, awesome. Thanks for saying that. So let's start by reminding our viewers about your background and your schooling, things like that, okay?
So originally from Oklahoma City, Oklahoma, born and raised. I did my undergraduate at the University of Oklahoma, and I received my degree in zoology and biomedical sciences. I then completed medical school at the University of Oklahoma College of Medicine, and then did my family medicine residency in Greenwood, South Carolina through the Self-Regional Family Medicine program there.
Wow. How long were you in South Carolina?
So 3 years. It was my first time being in the area, and I loved it. It was a great experience.
Oh, wow.
It's kind of how I ended up staying in the South over here, too.
Mm-hmm. So did you join Novant Health straight out of residency?
Yes. So I was really lucky to be able to start working for them. I had about 6 weeks off in between that.
Nice.
And it was a really great transition from going from residency, where I taught and interacted with a lot of children and patients of all ages. It was really nice to have a clinic opportunity to be able to still see children and adults also.
Wow, that's great. Well, now I know that you're at Novant Health Family and Internal Medicine in South Brunswick. And tell our viewers where that's located.
So that's at 75 Emerson Bay in Suite 102. It's right off of Highway 17 and Emerson Bay Road, and kind of quarters along with Persimmon Road also.
Oh yes, Persimmon. You can go onto Persimmon and then turn right into the practice there. And that's a great spot. I mean, it's very visible. Parking is great. The imaging center is right next door. That works out well.
Yeah, I was really fortunate. That was actually one of the big reasons why I wanted to join that practice, was you have on-site x-ray that you're able to do. Also, they can do ultrasounds in there, which is great for any of our patients. If we're worried about a blood clot, if we're worried about a fracture, we can just get them right next door, have those done immediately, and let them know the peace of mind, everything's okay, or this is what we found, this is our next step in treatment.
Yeah.
It's been really nice too that we also have the on-site lab draw, so we can do all of our labs on site. It's really convenient for our patients to be able to come and have them done before their appointment, so that we can talk about them at their appointment. And then also the same thing, if we need something done, if we're worried about a bladder infection, our patients don't have to drive anywhere. We can get all that done on site.
Yeah, it is. It's so convenient for the patient, so that makes it nice. Let's talk a little bit about the other providers in your practice.
So we have 3 medical doctors. That includes me. We also have Dr. George Bell, who is board certified in internal medicine. Dr. Candace Sieben, who is also a family medicine physician. We actually have the physician assistant providers from Seaside Family Medicine that will be joining our practice also, Hillary and Adam Thompson. They also treat children, so they're involved in the family medicine aspect, which is a really nice addition for us. We also have nurse practitioner Vanessa Norton, and then we just had endocrinologist Dr. Whiteside actually join our clinic this June, and nurse practitioner Virginia Zimmer will be working with him also. We've really been lucky to also have the specialists that come and rotate through our clinic on different days of the week. So we have general surgery, urology, and OBGYN that all alternate days at our clinic, and that's been really nice to have our patients have that close access instead of having to go over to Bolivia in the hospital and be seen by them at our clinic. And it's nice for us to be able to interact with them
Yeah, that's
also.
what I was thinking. Yeah, it's nice to have the interactions between the family practice and the specialists.
And it makes sure that we're really addressing all of our patient needs. So it's been really nice to have them, and they've all been incredibly wonderful and welcoming.
Well, nice. That sounds great. It sounds like a full house.
Yes, it is. And we're growing, but it's a good growing.
So I know that you're a board certified family physician. So again, that does mean that you see all ages. I guess you would see the babies up to the grandmothers. Is that correct?
So everything in between that. So part of family medicine residency is that you get to have a little bit of everything and get to see that family dynamic. So family medicine residency, we cared for women during their pregnancy. We were involved in the delivery, and then we saw them through their entire aspect of life. And then it is really nice to be able to see entire families, and that's something that Dr. Sieben and I really enjoy doing, and that also Hillary and Adam Thompson like too, is having to be able to treat the whole family and be involved with them on that personal and medical level also.
How young of a patient will you see?
So we had been transitioning from being internal medicine only in 18 and up to we had been seeing just ages 2 and up, but now we're going to start seeing all ages.
All ages, so a newborn.
Yep, so first right out of the life, we're ready to see them.
Well, that's great. I hear that you have a special interest in children's health. Is that correct?
I do, and a lot of that stemmed even before medical school. I was a swim instructor, and I love just interacting with the little kids and teaching them and helping them to grow and encouraging them. And that was something I really knew in medical school I wanted to continue in my professional career. So I love interacting with children, and it's great that family medicine allows me to do that also.
Well, that's awesome. That's awesome. Well, the timing for that topic is perfect because I wanted to talk about back to school and injections and their immunizations and things like that. So let's talk a little bit about what a parent could expect if they have a kindergartner ready to start. What should they do? How do they prepare?
Big thing is making sure they're keeping up with their yearly physicals with their medical doctor. So as all the parents out there know, once your child is born, you're going to be seeing your doctor about every 2 to 4 months, going through the developmental stages, making sure they have all the right vaccines, up until about 2 years old. After that, we do still want to see them every year to make sure we're keeping up with their vaccines. It is important in the North Carolina system to have the vaccinations needed because that is a requirement for children to continue their education and to remain in school. The biggest ones that I see that parents may have missed or gotten off on are obviously the varicella with the chickenpox protection with that too, and then the measles, mumps, and rubella. Both of those are really important to make sure that they've gotten, and so I really encourage parents to make sure if they're not sure their kid has had the vaccinations they need, call their physician, get in to see them, and make sure that they do have the immunizations that they need. If not, they have up to 30 calendar days, or the child will be asked then to remain out of school. Now, for parents that do not feel that the vaccinations are the best decision for their family, or if they have certain medical illnesses that would actually be exempt from having certain vaccinations, there is a form that parents would need to fill out that's available through the North Carolina website. Your family physician would also have access to that, or your pediatrician, and the school systems have that also. That would be important to fill out too and make sure that so your child is not asked to be kept out of school. If they haven't had their vaccinations and there is an outbreak for something they haven't been vaccinated against, your child may be asked to stay out of school though until they've been able to handle that outbreak so that your child's not affected by that, which could mean weeks to months depending on the disease process.
And I assume that the same is true for older children. They need to have yearly physicals and so forth to just to remain healthy.
Same exact thing. The big things for them will be the tetanus and the whooping cough protection, Menactra, and then the Gardasil for the HPV protections will be important for them also.
That is a good one. I hear a lot about that. It gets a lot of airtime on TV. So, well, I think that your practice is definitely convenient. It's like a one-stop shop. The whole family can go. It makes it easier for appointments and what have you. So I think that's a great way to go with families with children.
Perfect. We're hoping to keep expanding our practice. We'd love to see more patients of all ages, and just let us know if they need anything.
Great. Well, it's been a pleasure to have you back today. Our time has expired, and maybe we can have you back again real soon to talk about some other things with the children. And
I would absolutely love that. Just let me know.
Okay, great. Thanks again.
Thank you.